Hey guys, back with another contact lens video. We're going to be talking about monthlies versus dailies and which one is possibly right for you.
Now, the main difference between a monthly and a daily is with a monthly, once you're done wearing the lens for the day, it goes in your solution in a case and it's kept there overnight until the next morning. In the case of a daily, there's no need for any solution or case. The contact is just thrown out.
There are three main things that we want to think about when comparing monthlies with dailies. The first is budget, the second is hygiene or the health component, and the third is how comfortable they are. When we think about budget, monthlies do tend to be a little bit more budget friendly. So when we're looking at a year supply, for example, if you needed 4 boxes at $60 a box, that's about $240. And most of the time solution tends to cost somewhere around $40 for the year. So that would be a total of $280 for an annual supply. Now when we consider daily disposables, there's two main types, the hydrogels and the silicone hydrogels. The hydrogels are a little bit cheaper. Now if we consider an annual supply of those, 8 boxes at around $90 to $95 a box runs you about $750, give or take. Now with silicone hydrogels, they cost a little bit more. 8 boxes at around $105 to $110 per box. That comes out to around $880. So there does tend to be about a $100-ish difference between daily disposable hydrogels and daily disposable silicone hydrogels. Obviously, we don't want to make decisions based on budget alone. However, for a lot of different people, budget does tend to be something we need to consider. Now, if we get rid of the budget aspect and we just consider the other two things, the next one we'll talk about is hygiene or the health considerations. When handled properly, monthlies are still a really safe option. However, they do tend to accumulate bacteria and other issues a little bit more readily compared to dailies. In a study done by Stapleton and Cart, they suggested the microbial keratitis rate in monthly silicone hydrogel daily wearers tends to be around 11.9 per 10,000 people. Now, daily wear meaning you're only wearing them through the day and you're not sleeping in them. They also reported the rate in extended wear, so people sleeping in the lenses, to be around 18 to 25.4 in 10,000 people. Now, this is another reason why we should not be sleeping in our lenses if you needed another reason. They then went on to report that daily disposable wearers only had microbial keratitis rates of 1.9 to 4.9 per 10,000 people. This means that there are less severe events with daily disposable wear compared to monthlies based on what the research tells us. The reason we care about microbial keratitis is it is technically a vision-threatening condition and something that we always need to be aware of when it comes to contact lens wear. The last thing that we need to consider is the comfort of wear. Now, this tends to be affected by things that accumulate over time, mostly with monthlies. These factors that increase over time with monthly contact lenses include deposits on the lens from parts of the tears, dehydration over time, or a sensitivity to the cleaning or disinfecting solution. All of these factors are avoided when you switch from a monthly to a daily lens. Those are some of the main factors that we consider when it comes to determining what's right for each patient. Thanks again for watching. Take care.